Last month, Ascension St. Vincent Dunn Medical Center in Bedford closed its doors to the public, leaving IU Health as the sole emergency care provider in the city. WTIU's Clayton Baumgarth digs into the larger issue of medical care in rural areas.
Imagine having severe chest pains in your home, then having to drive 45 minutes to the nearest hospital to see if you're having a heart attack. For many Hoosiers, this isn't a hypothetical. It's exactly how those living in rural areas live every day. After operating in Bedford for nearly 80 years, Ascension St. Dunn Medical Center closed on December 16th. And while IU Health Bedford is still open, that hospital will be strained, taking on a new influx of patients when the flu, RSV, and COVID hit with full force.
We have brought on additional staff. For instance, in our walk-in clinic, we are now staffing that on Sunday. We have Sunday afternoon hours. We didn't previously, and we're staffing that with an additional provider.
Bailey has experience working in healthcare at rural areas. For him, this issue is nothing out of the ordinary.
We've seen some not closed, but cut back on services. There have been a lot of hospitals that have cut back on obstetric services, and then other programs that maybe weren't pulling their weight financially. So it is a struggle for rural facilities.
Crawford County is another area in Indiana that struggled with specialized medical care. People there have seen firsthand the issues that come with not having a well-equipped medical provider nearby.
We in the last couple of years have opened a second EMS station on the south side of the county so that we can respond to things quicker, because it makes it so urgent to get there as quickly as you possibly can, because you have to transfer somebody outside of the county for almost any situations.
One of the main problems rural areas face is attracting talent. That requires having good amenities, but having good amenities requires talent. It's a constant battle of asking which comes first, the chicken or the egg.
You need those kind of amenities in order to attract businesses and in order to attract workforce, but in order to attract those type of amenities, you have to have the population base. So it's kind of, you're trying to do both at the same time.
Some ideas floating around to help these areas are increased access to telehealth and a rotating roster of specialists that visit communities in need. For Belcher, a hybrid of those two ideas could be the most accessible for many communities.
If we had a brick and mortar location to where you could meet with a general practitioner, say nurse practitioner or something like that, and then they can pull in specialists as needed, it could certainly cut down on how many trips you have to make out of the area.
Unfortunately, the biggest hurdle rural areas face is simply that less population equals less income for hospitals.
There are just fewer people in rural areas. And if you think about the objectives of a hospital or a clinic, they're going to want to make money. And you're going to make money if you have your clinics and your hospitals in places where there are more people.
The consolidation of the healthcare industry has only exacerbated the issue. For years, large healthcare organizations have been buying into private care hospitals across the country.
And then those larger healthcare systems operate as a system. Their objective is to try to do what is best for their healthcare system rather than what is best for X small city.
This is arguably what happened in Bedford. St. Vincent, part of Ascension, which is based in St. Louis, bought the former community hospital 12 years ago. Ascension did not respond for comment, but did share a statement with media saying, after exploring the options available, including conducting an unsuccessful search for a buyer for the hospital, it was clear that other providers with a larger presence in the region are better positioned to efficiently serve the residents of Bedford and neighboring communities. In other words, Ascension is leaving it to IU Health to serve the Bedford community to the best of its ability. For Indiana News Desk, I'm Clayton Baumgarth.